Alright. Hello everyone, my name is Ella Coster, and for this week we decided to do our presentation on concussions. So a concussion is a mild traumatic brain injury that affects the brain function, and it's an injury that many people often know about, and the symptoms usually do not last forever, and when someone has a concussion, sometimes they do lose consciousness and sometimes they don't. Some of the symptoms and assessments. The symptoms can be subtle or show up later, and some of the symptoms that your family member or the patient will notice is a headache, amnesia, confusion, ringing in the ears, nausea, vomiting, fatigue, blurred vision, and sensitivity to light and noise. And then some of the symptoms that you as a family member will notice is a dazed appearance, forgetfulness and asking the same questions, a delayed response, slurred speech, irritation to others, and personality changes, and psychological adjustment problems or depression. Some of the causes. A violent blow to the head and neck can cause your brain to slide back and forth forcefully against the inner walls of your skull. If there's a sudden acceleration or deceleration of the head, for example, like a car accident, and it can be caused by a fall, high-risk sports, or car accidents. And having a previous concussion is also a risk factor, and within that, having previous concussions can also increase your risk of having long-term effects. So for the diagnosis, there's two different things that they'll do. They'll do a neurological examination, a cognitive testing, and imaging testing. For the neurological examination, they'll check your vision, your hearing, strength and sensation, your balance, coordination, and reflexes. And then for your cognitive testing, they'll look at things like memory, concentration, and your ability to recall information. And for people with severe symptoms like headaches, vomiting, and seizures, or people whose symptoms worsen with time, doctors may want to do a brain imaging test to see if the injury caused bleeding or swelling in the skull. Also, if the symptoms are severe, the family member needs to stay in the hospital overnight for observation. And the first 24 hours following a concussion are important, and the family member will need to be woken up regularly to make sure that they awaken normally. So for treatment, there's also two different things that they'll look up, that they'll do, and that's physical and mental rest, and they'll have a return to routine activity and pain relief. So for physical and mental rest, you want to keep the family member away from physical and mental activity. It is recommended that the patient stays away from mental activity for 48 hours following the accident. However, complete rest, like staying in a dark room and avoiding all stimulus, is also not recommended. And as time goes on, the patient will be able to slowly begin to return to activities as long as it doesn't worsen any of the symptoms. And for returning to routine, again, as time goes on, the more activity can be tolerated without worsening symptoms, and the patient can slowly go back to their day-to-day routines. And frequent contact with doctors is recommended when it comes to returning to playing a sport, because if you return too quickly, it can increase the risk of getting another brain injury. And then for pain relief, because the headaches are common with concussion, Tylenol is recommended, but it should be noted that Advil, Motrin, ibuprofen, and aspirin should be avoided because it increases the risk of bleeding. So for prognosis and follow-up, 85 to 90% of individuals recover within 30 days, and a small percentage of individuals will experience long-lasting symptoms, including, or that's because of failure to diagnose. And more injuries cause a higher risk of lasting effects. And education is important in teaching people to wear helmets and being careful during their high-impact sports. And those are our references.